All right, so welcome everybody. This is Michael McAvoy, and you're listening to the Metabolic Healing VIP support call. I've got my friend Sean Bean here on the call. Sean, are you here?
I'm here, Michael. Pleasure to be here today.
Thanks for being here, Sean. So, Sean's a friend and a colleague of mine, and I consider him to be a real troubleshooter in the clinical world. He's able to do a lot of different things and see a lot of things that other clinicians can't. And, Sean, yesterday me and you were talking about ways to reasons for clients falling through the cracks so often.
That's correct, Mike. And a lot of times, traditional medicine does a wonderful job of helping to deal with the symptoms, but they really don't look at the root cause of the equation. And as you and the other practitioners that are listening, I'm sure they see this all the time. And and the sad part, Mike, is, and you and I know, people are so caught up in this metabolic web that we have, and they're so focused on the current trends and the fads that they're just it's remembers the old thing. It remembers the old cartoon like Barney Rubble and Fred Flintstone, and they're chasing the dinosaur all around, and the people are chasing the dinosaur from one place to one place, and the next thing you know, Fred and Barney go climb up to the top of the hill, and they look to where the dinosaur is going to be, and then they club it. And that's kind of what modern medicine's doing is and people, they're just trying to chase symptoms, and hoping, you throw the dart at the right spot, and you hope it lands on the right area, and then that's what you treat. I always want to have an artist draw a picture about a bunch of doctors around a dartboard, and the patient's sitting in there, and the doctors are lining up on the dartboard, and around the dartboard there's a whole bunch of symptoms, and they throw the dart, and whether the dart lies, that's the symptom they treat. That's pretty much what we're dealing with. It's kind of like a lot of modern medicine is just shooting in the dark, and they're going upon symptoms. What we try to do as practitioners is we try to take that 40,000 foot view, as I call it, and we want to take a look at that 40,000 foot view before the person gets into a nosedive and ends up crashing, when all that stuff could have been prevented ahead of time. So what I've done over the course of the years is try to pull back and try to, instead of making molehills into mountains, I prefer to make mountains into molehills. And we do that by, the old saying is everybody asks me, "Oh, I have a complex case," and my response is complexity is in the eye of the beholder. It's how you perceive it, And as I know, and you know yourself, you're getting these complex cases, and it's something just simple that has been lost in the in the translationship of going from specialist to specialist to specialist to specialist. And one of the major problems that I see in medicine is that there are too many specialists and not enough generalists. Sean, everybody's asking me, like, what do you do? I said, well, I'm a specialist. I specialize in being a generalist. And they look at me like, what do you mean? I said, well, I want to look at the whole picture and not focus on it. And everybody knows, like a case I just had, they know that I specialize in Lyme, but I had to say, hey, you don't fall into the criteria. Your history doesn't support this. So just because I'm not a specialist in Lyme, I'm not going to chase that rabbit down the hole. It's something else. And we were correct. So what we try to do is we want to take the complexity out of things and move things into more simplistic thinking. Okay. If I had my opportunity, I'd create a website called analysisparalysis.com, because that pretty much describes what our health system is going into. It's going into a fight or flight mode, and they need to pull back and go back to the basics. Prime example, Michael, genetics. How many times have you looked at the genetics, and what have we gone back to? We have gone full circle back to the basics. Okay? Do we look at genes? Yeah. Okay. Do we take them into consideration? Yes. We take them as part of the history, not in treatment. Okay?
Yeah. Well, I think you're highlighting some really important points, and I before we go too deep, I want to just bring up a few things that struck my mind when you were speaking about them. So, the irony is that with like chronic Lyme, for example, the reductionistic viewpoint is that you treat the infection and it's all about getting rid of the infection because that's what Lyme is. But in actuality, because you're a specialist, or somebody would consider themselves a quote specialist, they wind up actually being more of a reductionist and actually miss the big picture and miss everything else that's going on and going wrong with the person. Something that a generalist could see better because they don't have blinders on. If is that what I hear you saying?
That is correct. That's an excellent explanation. And as we know, if you address the immune system, you address the factors that put the Lyme into remission. So everybody's asking, do you treat Lyme? I said, yes, but I do it indirectly. What I do is I try to find the imbalances in the pathways and the body that is not allowing the immune system to work at its full potential. And in majority, probably about 30 or 40% of the cases, just by doing what I coined the foundational work, people are getting better. And it's not something so complex, removing EMS,
Correct.
looking for mold, go back to the top of the chain, okay? The top of the chain is stress, but that comes from pathogen, it comes from environmental, it comes from emotional, and it also comes from structural stress.
Hmm.
And pathogens. Those are the main ones. And then everything funnels down. So what I do in history is I look at each one of those avenues
Hmm.
and show where the highlights are. And then from that information, you come downward into the immune system, the endocrine system, the neurological system.
Hmm.
And then by starting at the top of the cascade, you reduce all the stress on those systems. And then you address the symptoms within that systems to fill in the rest of the piece of the puzzle. It's really when I go through a case, as we have gone through before, and you had all these complex cases, and when you get down to the bare essence of it, it was just something simple, because we get lost in the transition of all the metabolic pathways and the genes and this cytochrome and this P450, and which is phenomenal to know. But the end result is by addressing that, are you really fixing a problem?
Great question. And even I would even argue that the immune system itself is really not separate from the endocrine system or the nervous system. And in fact, when you modulate one of those systems, you're affecting how another system is operating. Like take for example estrogen, testosterone, aromatase.
Mm-hmm.
How correcting that or modulating that often corrects some immune situation that's going on.
That would be a great example because all these women are like, oh my God, I'm estrogen dominant. And I say, yes, you're a hyperaromatizer from testosterone to estrogen. The reason being is because look at look at the viral panel we did. You have HSV1, HSV2, and EBV. Those are the main things that increase aromatase activity. Not only that, you're in a state of estrogen, and you're also in a state of insulin resistance. So how about we take care of the insulin resistance? How about we take care of the viruses and stuff? And guess what happens? You reduce the aromatase activity.
Correct. Right. Right. We need to be thinking about these systems as truly integrated and truly functioning as a unit rather than as a separate part or separate system, which is what allopathic medicine has done for so long, is considered all of these different systems to be separate, and that's why you have these different specialists and these different systems: endocrinologists, cardiologists, immunologists, blah 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 blah. But no one is seeing the integration of all of these things together. And if I hear you saying this, we need a more holistic model of looking at these problems, especially because illness now in the 21st century is complicated, and meaning that there's so many variables that are influencing a person's health. Like EMF is a relatively new thing throughout the course of human history. For that matter, the current evolution of what Lyme disease is very different than it was probably 500 years ago.
Absolutely. And, a lot of people, I have Lyme, but, I have a lot of people over in the UK, and 80 to 90% of those people that come over here, 20% get better. But because they're coming to a Lyme specialist, I go back through their history. I do different testing, the organic acid test. I look at different markers on their hormones. I'm like, I hate to say this. I said, this isn't Lyme. You're treating the wrong thing. And I find out it's mold. And you start treating the mold, they get 60, 70% better. But I told them, said, listen, just because you have Lyme, the mold is expressing the Lyme, and it can come in and it can come out at any given time of the expression. And unless you take care of the mold, you're never going to take care of the Lyme, because it's just going to be constantly lingering around there. And as soon as, other case was full-blown Lyme. And I was like, yes, but you also have mold. And we revisited the mold that we suspected a year ago, and I got this email saying, you would not believe what I found. Well, guess what happens? Because he was being proactive, because the client was doing coffee enemas in the bathroom, he would, every 20 minutes every day, guess where they found the mold? Right at the spot where he was doing the coffee enemas. So he was inhaling that. And what happened was it was causing these viruses to express. So they were chasing the Lyme Avenue down the road. And then I said, you need to look at the environment more carefully, because I said, I don't think this is Lyme. And that's when he ripped up the carpet and he just showed me the pictures. He's like, you would not believe what I found. And the mold remediation came in, they did their thing, and guess what happened, Mike? No supplements, no nothing. His symptoms improved by 70%. No antibiotics, just from the removal.
It's kind of an important thing that you bring up, because it seems like there's a lot of crossover between symptoms and conditions. So like Lyme and mold can look very, very similar.
Mm-hmm.
And I think one of the reasons for that is that we neglect to understand that it's the immune system itself, and it's the responses of the immune system that creates much or most of the symptoms and suffering. And so it's just a matter of different pathogens and the different frequencies that those pathogens may be emitting, which causes an immune response that's similar. And I think that again, it kind of goes back to your thought of this generalist versus specialist.
Mm-hmm.
It's how many parasites that could we identify in a person? Hundreds, thousands, maybe, most of which we've never even studied or know anything about. But at the end of the day, does it really matter which parasites you have?
Exactly.
It kind of becomes a question in that regard. And so I'm wondering if we're, even by talking about these conditions, is it even, somewhat too much of a specialty discussion about this, because if the immune system tends to behave differently in my body versus your body versus somebody else's body, but these pathogens that enter into it may produce similar immune symptoms, then what exactly are we talking about? Are we talking about, and it comes back to this balance between the physiology of the body.
Mm-hmm.
I think that we have to revisit theories like the germ theory of disease and learn and understand why that was so debated for so long, and why it wasn't generally accepted by people like Béchamp, because they refuted that the germ is what is the sole cause of disease. And I think we have to look at these things because a lot of people are suffering. But if you wind up going down a reductionistic path, you wind up creating a lot of collateral damage in the process. There's people that are taking antibiotics for decades and they're still not better.
Mm-hmm. And then what happens in that situation is in a case that I just recently had, we found out that they were allergic. We ran an IgG test, and they were allergic to every single freaking mold there was. And they were taking antibiotics. Well, the antibiotics they were taking were derived from the same fungus.
Right. Purified mycotoxins, right.
Purified mycotoxins, exactly. And she was livid when I found out this information. And it was like, I'm not making it up. It was in the testing results, and they were super elevated. I said, you may want to think about which type of approach and antibiotics you were taking, because it may be doing more harm for you. Again, this is the generalist view. This is taking all this data, pulling it all apart, finding how this piece fits in with this piece. Okay, how does this system communicate with this system, this system, this system, and showing the relationships. The key to successful success in complex cases is looking for the missing part of it's just not finding the data, but finding out what to do with it. What is it telling us? How is this system connected to this system? How is this nutritional deficiency connected to this, and this? And what do we do about it? Mm-hmm. And the hidden relationships, because when we look at testing results, a lot of the doctors look at them as an absolute. And I find that to be ineffective. What we have found and what you started working on, we started to see the hidden relationships by looking at a Dutch test. I showed you how we were able to distinguish mold from Lyme in the Dutch test alone, and then how to correspond that with other testing results to reconfirm that. Mm-hmm. And then we looked at the relationships between neurotransmitters. Just because they're in the normal range, it's the ratios. Mm-hmm. We have to look at the ratios and absolutes and how everything is connected together.
Right, and it's the important point of not taking a test result at its face value, but having a deeper understanding of what the underlying meta patterns are within the certain test markers.
Correct. That's why we're taking tests like the organic acid test, and we're starting to strip them down and being able to show gene expressions from the organic acid test, then have the blood test confirm that again. And everything that I would tell my clients, I said, listen, if you see one thing, you better have cross checks on tests to validate it. Okay? Wow, I have a zinc deficiency. I have a zinc excess. I said, no, you don't. You got a mercury toxic. Okay? And lo and behold, they had 90% of their mercury amalgams removed. Guess what? The that RBC zinc was still elevated after 6 years. It wasn't until the last bit of mercury was removed out of the system that red blood cell dropped from 15 all the way down to 10 to reveal the truth behind it. So it was interesting to show that one thing shows another, but in reality, there's something hidden there within the metabolic pathways that is not being seen. Again, taking things at face value, thinking they had an excess, they actually had a deficiency. Mm-hmm. Because it was the mercury that was binding to the receptor sites. Mm-hmm. So we have to look at how everything is connected. All the dots are connected. Dot your I's, cross your T's. You can look at different tests and say, hey, I have low thyroid. So, okay, I can show you the relationships between what markers can show you 3 different ways.
Right. I mean, how many people have low thyroid activity, but the test results are optimal, even with the tightest ranges?
Oh, yeah. I mean, even if your TSH is 1.5, your free T3 is 2.7, and you're completely normal. No TPO, no TGABs, nothing. But then all of a sudden, their symptoms are that way, and they're treating the adrenals, and it's not working. And it's like, by the way, you get the Dutch test back. And then on the Dutch test, mm-hmm. you see the pattern for cellular thyroid, where you see the elevated free, mm-hmm. and then it's not metabolizing, and then it's not being properly metabolized to the metabolized.
Hmm.
level. And then you got cellular thyroid deficiency. Well, there you go. Another marker you can use is LPA. If
Hmm.
LPA is elevated, that is cellular thyroid deficiency. Once you
So,
correct,
what also about prolactin link with hypothyroidism?
we learned that from our own personal experiences,
Hmm. Right.
you know, and it was amazing. It's like, hey, Sean, you're on to something here, you
Hmm.
know. And then I showed you the research showing you, yes, that low thyroid can increase hyperplacotemia that has effects on certain functions in males.
Hmm.
So it's
Yeah,
all
so it's again making sure you don't take the result at face value, because you could be missing the clinician could be missing something very important by just asking a question like, well, the test result, the standard thyroid blood chemistry doesn't necessarily reflect the effect of thyroid at the cellular level, and how that's affecting some cyclic AMP in these pathways that are in the cell. We can't get that data by just looking at a free T4, free T3, or TSH. Can't do it. So you have to look more at the patient history, other labs like you're saying, the cortisol, to metabolize cortisol, the prolactin, putting it all together to form a more specific hypothesis about what is going on in each case. And then what to do about that is a whole nother thing.
yeah. And what to do about it is you always want to start at the basics, the foundational work. The one that we found out with one case that we worked on, hydration.
Totally.
Just getting the person help properly hydrated solved a lot of the problems within a short amount of time. Because I asked him, like, let me review your case. And I'm like, oh, okay, I see what you're doing. We're working on stabilizing the circuitry because when you have adrenal problems, your circuitry gets thrown off because you're leaking magnesium, you're leaking potassium, you're leaking sodium.
Exactly. Salt
And
out to the urine. Yeah.
sort
Hmm.
out the urine and looking at the genes and stuff, you can see their NAT gene expression. So he asked him the question, said, by the way, you're a salt waster. I said, oh my gosh, John, I crave salt all the time. He said, well, you're leaking it. Put it back in, you plug the hole, but you got to take care of the adrenals in the process because you just can't plug that hole. Okay, you got modern medicine is basically like pouring water into a bucket that has holes in it. What, as a journalist, we do is we try to plug those holes
Hmm.
so that the water can stick.
Hmm.
That's what a lot of therapies fail is they don't stick.
Hmm.
Another big one is stem cells.
Hmm.
Stem cells has been one of the major issues that I've been, you know, has been helping some clients, but it's been not so productive in others, or it helps some, but then it causes other issues. That's because the people are not prepped properly. The proper reconnaissance missions are not done. The intel is not taken. And what they're doing is when you're doing a treatment like that, that is a one treatment that supposedly corrects a lot of things, which it can. But guess what? That 6 month comes back, your immune system kicks in. Guess what? If those viruses are taken care of, or you have the immune system prepped properly to handle that repercussion, you're gonna cause a cascade effect because the immune system found in 2014, they found that the immune system was linked to the same receptor sites as the neurotransmitters.
Totally.
But to us, it's common knowledge. But maybe some practitioners out there may not understand that. Hey, do you understand that 50 to 60% of the people going into mental institutions are found to have an underlying pathology of some type of immune system dysfunction
Hmm.
that cause the neurotransmitters to go out of balance?
Totally.
But no. What do? We treat the we treat the psychiatric with drugs. When
Drugging the brain with toxins, as Remo Libo would say.
Yep, and also if you look at the studies, guess what some of the things that actually help schizophrenics? Antibiotics.
Yep. Hmm.
If that doesn't surprise you.
Well, pyroluria has been shown to be reduced and improved by antibiotic therapies in some cases, which tells you that immune responses and pathogens can be a huge player in how the body utilizes certain nutrients.
Correct. And we see a lot of people that have zinc deficiencies in a lot of infections, immune system malfunctions, EBV, HSV1. And guess what? You have to you have to feed the host, not kill it. And, there are some mechanisms, iron is one of them, but iron's a double-edged sword. But people are now like, oh my God, I can't take zinc. I said, you better be taking zinc if you're deficient. It's not going to feed it, okay? It's depleting it is what it's doing. And that's why when people start getting better or they start treating the infections, the body, the zinc levels actually start coming up. Even treating the thyroid brings zinc levels up too. There's always, when treating the thyroid, if there is a zinc deficiency, there may be a 3 to 6 month lag, but the zinc levels will come up because you need thyroid to control the zinc. You can need thyroid to control the mineral metabolism of zinc,
as well as vitamin A,
as vitamin A, and so forth. So again, you have that relationship. And how everything's connected, how the nutrients are attached to the endocrines, how the cofactors are associated with the pathways, how all the neuro, the endo, immune systems all react with the pathways too. So the easiest way to explain this is they're like, "What are you talking about?" I said, "Think about a three-legged stool. You got the neuroendocrine and immune system. Each has a leg, and when you kick one of those legs out, what happens? You're going to fall on your face." So just like an orchestra, you have to make sure all the systems are balanced. Otherwise, you're not going to get beautiful music and you're going to get a racket.
Let's talk a little bit about vitamin D and the calcitriol versus the 25-hydroxy, and then the cell danger response and Lyme patterns featuring a high calcitriol and double that of the 25-hydroxy. Lyme has vitamin D receptors, but the calcitriol can also be dysregulated because of other things like the CDR, cell danger response signaling.
Exactly. And, we've been through a cell danger response multiple times, and, everybody's like, oh, I'm under methylated. Well, guess what? That's a response to the cell danger response. Vitamin D is a cell danger response. Reverse T3 is a cell danger response. Ferritin's a danger response. Even, downshifting some of the hormones is a cell danger response. So when we fill the gas tank with hormones and vitamins and we don't understand what's doing, and we don't understand the chemistry involved or these metabolic pathways, we're creating more problems than anything. So in regards to the vitamin D125, I was taught by one of my mentors, Dr. Leslie Fine. She was one who brought it to my attention and showed me. And I took that information, I ran with it, and I actually found that, once you get the vitamin D125 to 25 ratio, less than 1.5 on the tight end and 2 at the other range, you don't want to supplement vitamin D greater than 1.5 to 2. Because what happens is from what she told me is you actually start creating antibodies against your own antibodies. And what does that mean in Lyme? It means this. If you're treating with high dosage antibiotics, you're going to be successful with you have to use high dosage antibiotics. Otherwise, the vitamin D is just going to cancel it out. If you give vitamin D, you have to treat with high dosages. Now, when you reduce the vitamin D 125 ratio or reduce the total vitamin D down, say your vitamin D is 50, vitamin D 25 is 50 OH, and your 125 is, say, 110. In that situation, by supplementing, you are actually shooting yourself in the foot in regards to antibiotic therapy. Because when you reduce the vitamin D down, what it does is it reduces the need for high-dose antibiotics by about a quarter. This also goes into effect for herbals too.
And you've observed that when health is improved, that ratio also moves closer to 1-to-1.
Absolutely. When you have a person who has Lyme or mold and they get a mold hit, I've seen ratios jump as high as 3. After 3, after dropping their vitamin D down and going through mold treatment and not touching other than doing the binding and doing what we normally do to get mold under control, that ratio came down to a 1-to-1 ratio. Then I went back to supplementing vitamin D.
Mm-hmm.
So you can use it as a tracking mechanism
Mm-hmm.
on how your therapies are doing for what you're treating for the inflammation for.
Mm-hmm. Yeah. Yeah, it's great. It's very interesting. It leads to a discussion. If you ask the physiologist about that, he'd say, "Well, that means that the kidney is involved in the
Mm-hmm.
pathology." And I think, that's interesting because nobody even realizes that the kidneys are even an organ system that are doing things besides creating urine. But that's what's converting the calcitriol.
Correct. And when diabetics have problems, what do they have problems with? Reverse T3. Well, guess where one of the major sites of conversion is in our T3, actually stronger than the liver is, the kidney. So in Chinese medicine, when we treat the kidney, or we start treating the kidney by using herbs specifically designed toward that, guess what happens to reverse T3? It drops. So reverse T3 could actually mean a potential kidney imbalance going on that
Interesting.
you may want to think about. And maybe instead of, me and reverse T3, again, cell danger response, it's doing it for a reason. It's a built-in protective mechanism. But what we try to do, we try to override it. And then we end up making ourselves sicker.
The kidneys are a difficult organ to actually test. I mean, obviously, you look at the creatinine, EGFR, and BUN, but those markers don't flag until way later. There can be subtle changes in kidney function that are not detected at all on those three markers. Klinghardt talks about the use of the salivary pH and the urine pH as a metric to understand renal function. And when the pH of those, I'm trying to remember which one it is, but I think it's if the saliva pH is more alkaline and the urine pH is if the urine pH is too alkaline and the saliva pH is not alkaline enough, that's an indicator of renal dysfunction.
Mm-hmm.
And then he talks about how the kidneys have to be acidic and that metals will alter the pH of the kidneys themselves to being more alkaline, causing all kinds of problems. But the kidneys in Chinese medicine are considered the most important organ that regulates the qi of the body. And from a physiological standpoint, we can see that, they're not only an organ, they're also an endocrine gland. That's what generates your red blood cells through EPO.
Well, and also on top of the kidneys sit the adrenal glands.
Exactly. Yeah.
The two little pea things that are necessary for life. Kidneys, you also got, you got your aldosterone, you got your renin going on, and there's a lot of imbalances going on there that we see. And aldosterone is actually a major component hormone that's got to do with hearing. A lot of women that I work with, I put them on bioidentical aldosterone as long as they have, I think there's got to be a specific form of hearing. I think it's frequency.
I had a client several years ago who had severe tinnitus, and Dr. Nancy Mullen put him on aldosterone, and it cleared up.
That's the work of Jonathan Wright. He came up. There's actually studies that are done on it too, and working in the geriatrics area because of my mom and my father, I can and a couple of the other patients that I deal with, doctors, we see low aldosterone levels all the time in these populations. And
is that blood aldosterone?
That's blood aldosterone. That's blood aldosterone. That's low. I mean, aldosterone should be somewhere around, 12 to 18, and the range goes up to 28. So it's one of those hormones that you don't want super high, but you don't want super low either. And, when dealing with mold and Lyme, antidiuretic hormone's another one, that is throwing people's chemistries all off.
Right, and the ADH is what interacts with the kidney for water
Yep, yep,
regulation and the
yep,
tissues.
yep. And you end up with what's called cellular dehydration that starts the whole cascade of inflammatory prone cytokines all over the place.
Hmm.
And, then that starts the whole cell danger response and so forth.
Hmm. Yeah, the ADH is an interesting hormone. The posterior pituitary, there was the earlier work in the 50s and 40s with Melvin Page, who always seemed to come back to the argument that in many people the posterior pituitary is dysfunctional. I mean, never be able to answer the question why that was happening. And but yeah, certainly in mold, that's definitely one of the biomarkers to be looking for. That and the osmolality of the blood.
When the osmolarity, is it the high osmolarity or the low osmolarity that you want to look for in the blood?
Well, the ADH, the Shoemaker testing the osmolality and the ADH together to kind of get an assessment of the cellular hydration status and water balance. So
Mm.
I think if the osmolality is too high, I forget what the ranges are, but if it's above the top or below the bottom, and the ADH is uh, elevated, you've got a problem. But a lot of these things, a lot of the problems that are happening in our clients are happening in the tissues, not in the cells or not in the blood. And we kind of, from physiological testing, it isn't always easy to glean what that is, and that's kind of been the reason I've started really looking at the extracellular matrix is so critical, because it's the highway and the byway of how everything is getting to and from someplace, as
Hmm.
well as setting charge to tissues. A lot of the toxins get bound up there in the collagen. So it's clear that there needs to be a better, more holistic way of looking at the problems that we see. And it sounds like we're kind of talking about these things today to try to formulate a better idea of how to practice clinically with a more intensive and introspective view as to the problems and the complexity of the problems, but the solutions are usually a lot simpler than the physiology that we study, in some cases at least.
Yeah, I mean, you can take people that have been, another thing is people that have been on like 20 or 30 different supplements that are totally counterproductive to their bioindividuality is another factor that's really impacting the outcome of our complex cases. And it's not but it's you have to spend at least 3 months and sometimes getting the person back to a normal baseline because of what other things that may have done before they've gotten to you
Hmm.
is another factor that is, slowing the progress of cases down. Because a lot of my clients have become their own worst enemy. And I am also guilty of that because I've been on their side as well. And out of desperation, I've done some stupid things. But from that information, because of my science background, I've learned the mechanisms why. So when going through our own health journeys, we take every experience that we have, and these practitioners are the ones that have the determination, they have the compassion, because they either have a loved one or themselves who's been through the journey. And those are the ones that are going to really make the difference in health and have the drive and the desire to learn and to expand their knowledge and not get caught in these microchasms, such as yourself, practitioners such as yourself who are taking and going way beyond the current knowledge base and expanding it to new horizons. We
Well,
need more.
I think it comes down to not being satisfied with your own knowledge and always realizing that there's more to learn. That's how I
Mhm.
view it.
Yes, exactly. And just when you learn something, it can become addictive.
Hmm.
It's almost like a drug in many
Yeah.
ways. Because once you find one thing, it opens up Pandora's box to another, to another, to another.
Hmm.
But this is how we make progress. Sometimes we have to fail in order to make success.
A lot of times, absolutely.
You know,
100% agree with that. So it's great having you here, and thanks, Sean. I really appreciate you coming on and talking. We definitely would love to have you again. And
absolutely, Mike. It's been my pleasure.
all right, so just to give a little plug here for Sean, Sean's website is matrixhealthandwellness.com. Is that right?
It's matrixhealthwell.com,
Matrix
well.com,
WELL
.com,
.com.
and I'm available for, complex cases. I also do practitioner review cases too, um, to help practitioners get that extra edge, and to help them see these hidden patterns, that can be easily taught in a short amount of time. Because you really don't need to know the biochemistry. Once you see it, you will be able to identify things a lot faster, and that way you're able to increase your therapeutic output and reduce the need for excessive testing and supplementation in the process.
Hmm. I can't recommend Sean highly enough for the clinicians listening out there. He's one of a kind, and if you get a chance to work with him, you will definitely learn a lot in a very short amount of time. So, thanks everybody for tuning in. Thank you, Sean Bean, and this is Michael McAvoy signing off. Take care.
Bye bye.